Under the, I'll say most of the key points from the ER recommendation is really to look at what we say is the fluidity, and for that, the first thing is to get additional outside bed. So when the people have been taken care of, they had their operation, we can send them to a place where they're safe and they can have their rehabilitation or whatever. During the summer, first thing we did, we went under open bid to get about 1,700 places, and 58% of them have been called. So this is good news. We have now a solid 800-900 beds where we can send those people that are ready to get out of the hospital. So that's good news, okay? So there was an issue of capacity. But that will not be sufficient because that's only 1,700. The second thing is we're saying that pour les soins à domicile is where we can tell somebody and their relatives, we would like to send that person back home right after the operation, but as long as it's safe. So it's safe being with le prochain aidant, but it can be with a nurse or it can be with un préposé ou bénéficiaire, you see. So, and this method have been tested in some places, La Nausière as an example, but it has not been implemented all across Quebec. And there is no reason, again, why this is functioning and this is approved since 2017. Well, is it a question of culture? Is it a question of approach? So we're saying we will put a lot of pressure in the next few weeks for this to happen. So for people to be able to be waiting at home in case they need a place in CHSLD, but to be done safely. And basically, I think the third measure for the fluidity is that we have in certain hospital, and I'm using the Jewish as an example, they have a command center. The command center are people that are very knowledgeable in the way it is safe to allow within the hospital, not only for emergency, but for surgery. Because when you have a free bed from the two measures that we just discussed, the doctors are fighting, and I'll say that politely, they just want to either to operate or to liberate those beds. So I think the command center in the Jewish has been able to keep this better balance of making sure it's not always the emergency room that pay the price and keep those patients downstairs, okay? So the good experience that we have in the Jewish and other place will implement that in other emergency room to improve that fluidity within the hospital.
The big word is implement. Why do you think these measures have not been implemented at this point? It's clearly not for a lack of hard work and many hours and spending many hours in hospitals. We see the healthcare staff really overworked. So what is the key in all of this to actually make it happen?
Well, again, we all know that we went through a pandemic in the last 2 years, and I think it's a question of priority. Now that I think we have a better control over the situation in the pandemic. I'm just touching wood when I say that. But I think the second point is that it's a matter of priority. We're not asking the PDG to work on 10 things. We're just asking right now, surgery, we've talked a lot about that, and emergency, to me, that's the other priority right now on the table.
I think there's an issue also of culture change. If you speak, for example, we've gone several times to the Jewish General where it really is, there has to be a buy-in of the whole team, not only the emergency room, not only the physicians on the floor, but really an entire hospital system from the top right down. And so we've seen, and we discussed with Dr. Afalala when we were there, he talked about the challenges of knowledge transfer, because as the minister mentioned, we have given funding for medical coordination. We have made ateliers where we've invited people from all over Quebec to come visit the Jewish and other centers to see how it's done. And so it's not so easy to incite change and to do the knowledge transfer. But now there's an urgency, because I mean the bottom line is that the absolute volume of people coming to the emergency room is the same as it was in 2017, 18, 19, albeit more seriously ill. But there are hundreds of beds closed. And so that is what drives right now the length of stay in the emergency room up, and the really huge urgency to put into place all these measures that the minister and Mr. Darnay and I've been, and the letters from the emergency department chiefs and everybody in the papers are talking about, to put into place rapidly to address the fact that we have this issue in terms of human resources, which means these other solutions are quite urgent to put into place.